The World Food Programme reported that with COVID-19, the number of people suffering acute hunger in 2020 could reach 265 million globally. This food insecurity will disproportionately affect Africans as millions can only eat if they earn a wage. Examples of this potential food crisis on the continent is made worse by the COVID-19 pandemic. 1. In Zimbabwe, the World Food Programme is working to ease hunger, which has risen to 4.3 million, up from 3.8 million at the end of 2019. Although its funding is insufficient, the program assisted 3.7 million of the most vulnerable Zimbabweans put food on their table. 2. The lockdowns and health impacts of COVID-19 on African countries are worrisome. The drop in overseas remittances will hit Somalia hard, as the United Nations estimates the diaspora send home $1.6 billion annually, which is significantly more than foreign aid, and is equivalent to about 23% of their GDP. The loss of tourism receipts will damage a country like Ethiopia, where it accounts for 47% of total exports. South Sudan is being impacted by lower oil prices, where oil accounts for 98.8% of its total exports. 3. People scrambling for food in Lagos, Nigeria is the new normal. The federal government and humanitarian organizations distribute food to ease the pain of the lockdown imposed to stop the spread of COVID-19. In Guinea, businesses and hotel services have been forced to close and thousands of workers are laid off. 4. South Africa has a nationwide lockdown. The government is distributing food to about 54,000 people deemed vulnerable. According to Amnesty.org website, a local TV station in Mozambique reported cases of police accused of taking advantage of the state of emergency to raid informal vendors' tuck shops and steal their goods even when the tuck shops are closed. 5. In Nairobi, Kenya, there was a stampede caused by thousands of people trying to get food aid. This is because COVID-19 pandemic restrictions keep people from making a living. The street children in Kenya rely on the streets for food and shelter. The youngsters are being stigmatized and criminalized when the cities lock down. These children are also caught up in outbreaks in slums, where physical distancing and good hygiene are hard to observe. As always, thanks for watching. Please thumbs up, share, leave a comment, and don't forget to subscribe. Again, try to be grateful and think positive.